Living Clean, Living Well is a presentation of the Canadian Centre for Abuse Awareness.
Hello and welcome to another edition of Living Clean, Living Well. I'm Sanderson Layng. I'm sitting in for Teresa Cruz tonight, our regular host. Teresa's off celebrating her birthday, and so we told her to enjoy it and enjoy the evening. She's at a rock concert, and if there's any Supertramp fans, and so if you want to send a birthday gift to Teresa, anything associated with Supertramp would do quite nicely. We've got a whale of a show for you tonight, and I'm really excited about it. And we're going to be talking about issues that are of interest to everybody when it comes to therapy and counseling, and what you might have to go through to find the right counselor and to get into the therapy that you need and that's going to be right for you. So we're going to be talking to our guests about that. You know, we're also looking at the news and seeing what's going on out west. We've got a lot of viewers we know out in Alberta, and tonight we're still at nighttime in Ontario. We're wishing you well in Calgary and in southern Alberta, and hoping that you're coping and getting through a difficult time out there. One other issue I wanted to mention, we've got an album that we want to recommend to you. Here's another good gift that if you want to send to somebody. The album is called Frontiers. The group is called Odic Poets. Odic Poets is how it should be pronounced, Odic Poets. And the fellow on the right that you can see on your screen there is Jeff Lafray, who is the director of this television show. So we're wanting you to take a look at this. If you want to get on Facebook and like this album, you know, you will like it, and we'd appreciate you taking a listen to it and having a look at what they have to offer. So, moving back to our set, I'd like to welcome our two guests tonight. We have immediately to my right Dr. Rick Zernick. Rick is an author and a professor of addiction studies, and just down the table, Dr. Vera Tarman, who you know is our regular clinical advisor, medical advisor here on our show, and is also you know, the medical director at Renascent. And you've seen Vera many a time on our show, and so Vera, welcome back, and Rick, it's great to have you back with us as well.
Thanks a lot.
So we were talking and getting ready for tonight's show about the issue of therapy and how we're always encouraging people with addiction issues to get to talk to somebody, to get into therapy, and so many of our callers talk about how beneficial it's been, but it's not all that easy. Mm-hmm. And it's a bit of a gauntlet that you have to run here to get into therapy and to get the right kind of therapy. If either of you were going into therapy, would you require that your therapist was in recovery themselves?
That is a classic question. There really are two schools. Addiction is a fascinating profession. Historically, it came out of people with recovery. Doctors, social workers, psychologists didn't have much to do with people with addiction issues. They were really much left to their own regard. And so those in the recovery movement developed and created the addiction treatment system. Since that point in time, we've become much more knowledgeable. We have an excellent body of research. We have some best practices that we follow. And so there certainly is a group of people who are well-educated, well-trained, but don't have recovery histories that are able to offer good counseling, good support.
Mm-hmm. What about you, Vera?
Well, I, as you know, I work at Renaissance, and one of the primary requirements or prerequisites for the counselors, the frontline counselors, is to be in recovery because they believe that a person who's got personal experience can offer a more empathetic and understanding approach. And I think that, Rick, you're probably right that it doesn't really matter, but I know that from the client point of view, patients are always telling me that they prefer it when the clinician or their worker, their counselor, has a history, that they can tell the difference and that they feel, if nothing else, like less shame. Like, you know, you have the same problem as I do, so we're not on, we're already on the same table. Yeah, I don't think that there's that expectation from their physician, and they're not likely going to get it because physicians have other rules that they have to follow. They have their own patient confidentiality and other issues that they have to work with as well. But I think when we're talking about one-on-one counseling, it's a preference. I don't know if it's necessary, but I think it's a preference.
Well, I'm wondering, in looking for somebody, what's the first thing that you're going to look for? What would you be looking for in a counselor then?
I think probably their ability to listen and not want to give advice. I would want the most. I don't know if I would really need them to be in the same position as me. Personally, I don't know if I'd need that. But I would be turned off right away by somebody who had a very clinical, professional approach where they were going to give me the answer. I know that wouldn't work for me.
Yeah, I mean, there's a whole notion of what's a therapeutic alliance. How do you build rapport with an individual? And I guess anyone that is a good counselor has respect for the individual coming in for them. So do you appreciate where the person's come from? Can you listen to their story? I absolutely agree with you 100%. Do you have space where it's safe? I mean, creating safety is wonderful, where what you've experienced is valued in terms of how you've gotten here. And I think the most important question for any counselor to ask you is, what brings you here today? What is it in your life that's brought you to the point in time where you're ready to make a change in your life? Because we know people with addictions, it takes a long time to develop. There is still a lot of shame in our society around it. So it takes a lot of courage to step forward and to come to seek help from somebody else. And our society is a lot about individualism, being rugged, and to reach out and say, you know what, I need help with this issue. It takes a lot of courage from people. And so your counselor wants to be able to respect that in you. And that's what I look for as well, as someone who values me as a person, despite the fact that addiction is part of my life.
Well, it is a scary process. And, I've seen sort of some really good examples of how to deal with it. Places that take a lot of care with, how people are received, and, we always talk about there being people in white coats and, the old hospital model, et cetera. And that's, usually not the case. Certainly the places that I'm familiar with, it's a very warm, rich environment, and the warmth comes from the people as well. But, there's also people out there that have a shingle out and have experience that they've gained because they've taken a course. And they may not necessarily become, a member of some college or a body that governs, their practice. How important is it that you be talking with somebody who is accountable to someone?
Okay, I think it's pretty important because if nothing else, you want to be able to, I don't know if you want to say complain about the person, but you want to be able to have some recourse if something happens. But I mean, it's an assurance because you don't know this person. It's an assurance that somebody else has designated that this person knows what they're talking about, because you're very vulnerable. And this is a person that might be guiding you to make decisions that are going to have a major impact on your life. I want to just add another piece to your first question about what else that I would want. I think that aside from some kind of professional credential, which doesn't necessarily mean a college, but something to show that they've indicated enough interest that they know something about the material, is I'd also want to have a sense from them that even if they weren't an addict themselves, that they still had something that I wanted. I mean, if they're sloven, if they're clearly not taking care of themselves, why would I want to take advice from them? Like, I'd want them to somehow have a sense that they may not share my problem, but they have an approach that I want to be mentored by. And I think that would be really important too.
Yeah.
Yeah.
Yeah, indeed. Well, we're just going to take our first break, and when we've already got calls coming in. And if you've got experience with seeking out a counselor, a therapist, if you've got a story you want to share with us about what the experience was like for you, some of the do's and don'ts, some of the dangers, the rewards, the pros and cons all of that. We're going to be talking about that in our next segment, so don't go away. We look forward to talking to you soon. We'll be right back. Welcome back. We're here at Living Clean, Living Well. Wherever you are across the country, hopefully if you've had a chance to look outside tonight, you've had a chance to look at this incredible moon that's out there. It's huge and it's big and bold and beautiful, and it ties us together in that we're all living underneath it and can all share that experience. As soon as the show's over tonight, actually, I'd recommend you take a look out at it. It seems quite spectacular. And so there's something that binds us together, and we're also bound together, most of us, by looking at this issue of addictions and how we get treatment, how we deal with issues of who we see, whether we find somebody who works for us, that hits the mark, is able to respond to us in the ways that we would want best. So let's get some feedback about this from our callers. Line 1, Anna Maria is calling from Toronto. Good evening to you.
Hi, how are you?
We're great.
Great. Just wanted to say thanks for being there. Yeah, my name's Anna Maria, and I'm from Toronto. I'm actually just calling in just to share a little bit about my experience and my experience with therapy. I'm actually in recovery from alcohol and drug addiction, and you know, I go to, for my alcohol and drug addiction, I attend 12-step meetings. I go to AA, I go to Cocaine Anonymous, I also attend Narcotics Anonymous, and I go to those meetings to talk about my struggles with alcohol and substance abuse. Apart from that, I have like underlying issues, childhood sexual abuse, trauma, physical abuse from my dad, just things like that. And that kind of therapy, I don't seek out in the rooms of 12-step meetings, because I don't believe that people in 12-step meetings are actually qualified to, counsel me in that area. Correct? So, I guess my point being is that for me, the gentleman with the red shirt actually made a really good point. Like, it's about building a safety with whoever it is that I was sharing with. I find that it's not important that my therapist have experience with the kind of trauma that I've experienced, but that they're well educated and that they have like good grounding techniques and how to help me to stay safe when I'm sharing things that have been traumatic in my life. And one more thing I just wanted to say was, for my childhood sexual abuse, I go to the Barbara Schleifer Clinic for women. I also, for group therapy, where, we talk about different things, I go to CAMH. They have group therapy there. And I also go to the Elizabeth Fry Society because I've had experience with the law, and the Elizabeth Fry Society is actually for women that are looking for therapists that have had problems with the law. Yeah, I just kind of wanted to put that information out there, it's one of the best things I've ever done for myself in my recovery, it heals pieces of me that I can't do in 12-step meetings. Yeah.
Well, that's great. Anna Maria, thanks so much for calling in.
Yeah. I mean, you are an incredibly resourceful person. To be able to find those various different resources you need, to be able to integrate them, I think that speaks to you highly. There's a program our viewers in Manitoba know, in Winnipeg, called the Laurel Center. We don't have many like that across Canada. It actually combines treatment for childhood sexual abuse of women and addictions and integrates it so you don't have to go around to 2 and 3 agencies. So we don't, I mean, one of the limitations of our resource network is we don't see what we would call intersecting oppression, someone that's had a trauma history and addiction history that can come together. So Anna Maria, I think what you've been able to provide the listeners this evening is that often addiction counseling alone is not enough. You'll have to find something else to support you if there's an underlying issue, and that's more than acceptable to have more than one counselor in your life.
It seems to me in my work at the Canadian Centre for Abuse Awareness that the relationship between trauma, whether it's from childhood sexual abuse, some trauma, whatever its source, and addictions, there are very few cases that I've come across where people aren't self-medicating. And I look at that and think, well, under those circumstances, anybody that's in that kind of trauma, that's experiencing that kind of pain, has to find some coping mechanism. And is the addiction the sort of interim stage to therapy? Is it the transition? Is it the step people are going through because they're not able just to move right into some therapeutic relationship?
Well, I mean, another way of asking that is it a form of self-medication? And I think that, yes, it absolutely is. So when the person stops their self-medication, they're back to square one, which is how to deal with the trauma. One of the things I really liked about Anne-Marie's comment, and thank you, I agree with Rick, you're very resourceful, is that you said that it didn't matter if the therapist has the experience in trauma, but that they have the awareness of techniques like grounding techniques. And that's the kind of stuff that I think the therapist needs to be trained in, is because I think a green therapist, somebody that hasn't had training, would want to jump into the trauma and let's explore that and let's get all of that stuff. But I mean, with training, you learn that no, you can't do that first. You have to do grounding techniques, for example, and stabilizing techniques, the very things that person hasn't learned and therefore had to self-medicate. Because you want to find something to avoid having to self-medicate. Yeah.
Yeah, and then another important point too about finding a counselor and find that right fit for you is that if you're going to a counselor and you don't think they're helping you, they may not be. It is more than acceptable to go and find somebody else that may be more. And I mean, I'm not talking about finding a counselor because they're telling you something that's hard for you to hear. I'm talking about someone that you've gone to for an extended period of time and you're not moving forward. I mean, counseling is about change. It's about moving forward. It's about changing the behaviors that you're engaged in. And if you remain stuck, then this counselor may not be the best fit for you. And your counselor should say that as well. It should say, I mean, we've gotten so far, but you may need somebody else to push you further.
You raise an issue of how well counselors, and this may be, we were talking before the show about whether doctors make good counselors. They get very little training in counseling.
Yeah.
And yet maybe they have some better understanding of the issues related to trauma, and the fact, what's going to happen is if you try and rush somebody through and get them to a stage of recovery when you're not ready, and that you end up doing more harm than good.
Yeah, I mean, the medical model is really not a suitable therapeutic model. And a lot of people seek out medical care because it's covered. And that's the main reason. But it's not, you're absolutely right, physicians are not trained to do psychotherapy. There are some who choose to, and as a result have a different approach. But the general medical model, which is a very rushed 5, 10, 15-minute session, you can't do very much there. I mean, yes, there is some work you can do. You can propose an intervention like, you really should quit smoking. Have you thought about how much you drink and what it's doing to your life or your family? But beyond that, it needs something that's much more than what a medical doctor can provide.
I mean, if we see addiction as a biopsychosocial phenomenon, I mean, obviously the medical profession has a key component, as do counselors. And again, this is a notion that often seeing more than one person is relevant because of the tripartite nature of addiction, is that your profession, my profession coming together can often give the best care to someone in need.
One example of how the medical model isn't really useful is it's a very instructive paternalistic model. I mean, it's, you've got high blood pressure, Sanderson, and therefore you should stop smoking, you should stop doing all these things. I'm telling you what to do. And that's not the way good therapy works. Good therapy, you sit back, you give the support that you were talking about, and you let the person, you guide the person to find their own wisdom. That's not a medical model.
Yeah, I mean, good counseling is about choice. It's about providing clients options. I mean, your example of trauma was very relevant in the fact that the addiction becomes a coping mechanism, and after a while, all the coping mechanisms you have become minimized because using a drug to deal with trauma is excellent. It clouds your memory. You forget about the pain in your past. It's a great tool, but it develops its own set of problems. And then you have not just one issue to deal with, you have two issues to deal with.
Yeah.
And so you have to put the addiction aside, and you still have to go back to the trauma, or the healing will never be complete.
So I'm trying to think whether I'm more encouraged to seek out, counseling, or whether it's now this kind of very complicated circumstance. But if I want to take my car for repair, I still want to take it to some place where
Yes.
the mechanic knows what they're doing.
Yes.
I'm just happy that they recognize me when I come through the door, and they know my car, and it's welcome back again kind of time. But this is life altering, and the choices that I'm going to make, and if I'm in a situation where I'm struggling with an addiction issue, I may not be making the best choices, and now you're telling me I've got to make a really good one here.
Yeah, which is probably why having some kind of regulatory body would be useful, because in that sense, some of those decisions are made for you. It's not, I think that's the addiction in the social service industry that's developing right now. I don't know if it's quite reached.
It's a voluntary college right now.
Yeah, you have to.
Yeah, again, and if you go back, as you said earlier too, I mean, you need to have some sort of counseling degree. I mean, addiction, again, because it's biopsychosocial, we have people with medical backgrounds, people with social work backgrounds, psychology, all work in this field. And so one of the questions you have is, do you know anything about addictions? Because you'll have social workers, psychologists who will be excellent clinicians, but not know the addiction field. So that's the critical question is, are you well versed in addictions? You might want to ask, you have a recovery history. Some professionals will be able to tell you, some will not. I mean, that's the reality. But do you work in this field? Are you comfortable working in this field? Again, addiction is a lot about loss and about bereavement and about recovery, and those are very universal attributes that many good counselors will be able to deal with.
Yeah, but it's interesting because with psychiatry, so a psychiatrist is expected to deal with any kind of problem, but there aren't that many psychiatrists who are well versed in addiction. And right now, I mean, I belong to the American Society of Addiction Medicine. That's a certification body in the States where I had to write an exam, pass and get the certificate so I can say I have an experience with addiction. But a psychiatrist can work in addiction and not have that at this stage in the game. And they might not have the same understanding about addiction that I will have, or a psychiatrist who's taken that extra training. Because we're still at that stage, even in medicine.
Now, some provinces, and again, we can't speak to every province, for those of you in Ontario, we do have a series of assessment centers where there's an agency you can go. They will give you a series of questions they'll ask you. I mean, it will take 2 or 3 hours.
Oh, I see.
And they will assess the nature of your addiction, how severe it is, and they will give you a recommendation based on what you tell them about what the best option are. Now, that's not the case in every province, but Manitoba has AFM. Alberta has ADAC, which has now been merged with the Ministry of Health, but there are centers that are free of charge in many of the provinces where you can go and they will spend time with you to determine what the best course of action is for you in terms of counseling and set you up with someone that is specialized in addiction.
Like I think in Toronto we have MARS.
You have, that's correct.
Metro, do you know what it's
Area Assessment Resource Center, something like that.
Yeah, and then there's DARTS as well.
DARTS is province-wide.
Yeah.
So there are services certainly in various provinces. If you don't, sure, many large communities have community information service centers. You can call and say, who can provide me a free addiction assessment, and they can tell you if that exists in your community or not.
Oh, that's more encouraging then. So if you're not sure what you're looking for, you're not sure the counseling's even right for you, somebody can talk with you and assess the situation and then help you connect with.
And there are specialists trained exactly to do that connection for you, because again, first time in the field, where would you go the first time? And
Yeah.
that's what their responsibility is.
My guess is that what a lot of people do is they go into the treatment centers and then get funneled to the various services outside, like within that program. Like, so if somebody goes into Renaissance, they're going to get funneled into the counselors that have a very 12-step focus. If they go to CAMH, they're going to be told about the various programs that CAMH has. So that's probably a very common entry point that is trustworthy within the framework of, I mean, you know, you go with the people who've had experience. I mean, word of mouth, basically.
Yeah.
Yeah, word of mouth that center will give.
Yeah. Well, here we go. We've got a situation now where there's some possibilities here. And if you're sitting out there and thinking, you know, I could sure use talking to somebody who's a good listener, who's not going to judge me, somebody who is just there to maybe help steer me in the right direction. You know, there are opportunities for that. And, you know, we hope that you'll be resourceful like Anna Maria and look around and see all of the opportunities that might exist for you. And also on our website at abusehurts.com, we have those kind of resources listed for you, so we invite you to come and see them. We'll talk more about that. Also, Darlene is holding from Hamilton, and we'll be talking with Darlene when we get back from the break coming up right now.
I've had numerous opportunities to get into addiction counseling over the past 5 or 6 years. This one at New Awakenings really appealed to me. First off, the facility here, we've got a swimming pool, there's a gym downstairs. Other side of the fence, golf course, it's fantastic, and the food is, world class. The staff cover all aspects of recovery. These are people with extensive experience in the field, all with the sincere desire to be helpful. If you want a shot at recovery from drug and alcohol addiction, New Awakenings is your best bet. Give us a call, we'll get right back to you.
And welcome back. This is Living Clean, Living Well. I'm your host, Sanderson Layng, here with Dr. Rick Zernick and Dr. Vera Tarman. And we're talking about issues related to therapy, counselors, the do's and don'ts, what dangers there are, what benefits there are. You don't want to get lost in the shuffle when it comes to whether or not to do this. We've had so many callers, so many people tell us that their lives have been turned around completely, and there's a tremendous amount of hope and encouragement to be had by that. Let's talk to Darlene in Hamilton on line 4. Hi, Darlene.
Yes, good evening. Good to have you in my bedroom this evening. I was counting on an early night's sleep. I guess we were supposed to speak this evening.
Okay.
I have my experiences are like with Anne Marie, and I do applaud her as well. The Elizabeth Fry Society, for me personally, has been the most impactful in my life through my recovery processes. And I went there in early recovery about 8 years ago to seek anger management counseling. And through that process, followed through with about another 5-year period of one-on-one drug addiction counseling. And they have been the most influential in my recovery personally, as well as, you know, the 12-step meetings are as well as way up there for me. So, yeah, my experiences have been quite positive. I'm very involved with Women's Detox in Hamilton for a particular fellowship, which is CA, close to my heart, you know. So, yeah, I'm pleased to say that the Elizabeth Fry Society I would highly recommend to any women on many, many levels.
Well, that's great. Thanks for calling in, Darlene.
Yeah, you know, I think, can I take?
Yes,
yeah.
sure.
I mean, Darlene, thank you for mentioning a couple of things. One thing I heard you say is that you're involved with detox work, and what that tells me is that you're doing service work, and that's one of the best ways to get support yourself. I mean, in giving support, you get support, and it's a really, really important tool. The other thing is just to give hope. I mean, it's a bit hard. It's a bit of a tangle to find a therapist that's going to be suitable. But in the meantime, there's a lot of things you can do that are actually possible. And I don't know Hamilton, but in Toronto, CAMH has a tremendous wealth of programs, anger management programs, cognitive therapy programs, the meditation programs that are not one-on-one, but they're group, and they teach you tools that are very, very, very useful in the interim while you're hunting down somebody from a more personal perspective. So thank you for mentioning that.
I think an important point for people to pick up on is, you said 5 years. This is a journey. It's not something, and often when you go to see a counselor, you say, can you fix me today? And the answer is no. It is a path. It's taking a while to develop the dependency, the other issues there, and it's not going to get better overnight. And so the fact that you've been at this 5 years speaks to the fact that it took you a while to get to the point in time where you said, I've got a drug or alcohol problem. It takes you a while to get back to the point in time of recovery too. So that's a very important message as well.
But the other thing you said is the person asks, can you fix me today? And the answer is no, I cannot fix you. You have to fix yourself, but I can help you fix yourself.
Facilitate the process,
yes,
absolutely.
Exactly. That's a really key piece. And I know that especially in the medical realm where we're given the authority, where somehow we have an answer that you need, they want me to fix them, and I can't do that. I can't do that at all. Really, the best that I can do is, like you said, facilitate that they find their own way of fixing themselves.
So perhaps that's something else to be careful for. If someone says, yes, I'm going to be able to do this for you right away, that's another warning sign about the counselor. The counselor is going to work with you to help you collaboratively move forward.
Yeah, exactly.
So if they create too high an expectation that this is going to be like this, and
yeah, it's almost like it's a kind of magical thinking. If I get into the doctor's office and talk about this, it'll get sorted somehow. And it really is. It's magical thinking. That's the beginning of the process, because you actually asked for help. That's as far as it goes. Now it's up to you, and collaboratively to make it safe. Really, it's my job to make it safe for you to explore your issues.
And so when you see things like, I'm going to hypnotist and I'll solve my problem in one session, that's that magical thinking.
Yeah.
I mean, nothing wrong with hypnosis, it has its value, but to say you're going to be cured, it's a process.
yeah. Okay, let's go to David in Toronto. David on line 1. Welcome to the show.
Thank you very much. I just have I have a question. I haven't really followed the full conversation. I just turned the TV on not long ago. But I'm a recovering addict and alcoholic myself. And I was just wondering if there is, do you believe that there is, like I work at, I'm in AA and I'm working a 12-step program. Do you believe there's other ways of recovering other than a 12-step program? You talk about one-on-one counseling and stuff like that, and I'm taught that I pretty much have the belief that it's the only way. And I'm just wondering what your take is on that. Is there other ways other than a 12-step program to recover? They call it maybe an easier, softer way, or that's, I don't know if I don't know. My other question is, I'm cross-addicted, and I guess I'm only allowed one question, but I'm going to throw it out there. I'm cross-addicted, and alcohol was never my primary. I never really got into too much trouble drinking, but I got into trouble with drugs and gambling and stuff like that. But now I'm in a program where it says I'm allergic to everything that's mind-altering, and it's tough for me to accept that I can't drink. I have a hard time calling myself an alcoholic when it didn't really get me into trouble. So I don't know. I don't know if you can answer that.
Well, we'll give it a shot. We got 2 questions there.
Yeah, they're both big questions. You want to take the first piece?
I'll start with the first piece. The answer is that AA is a wonderful mechanism. It's self-help, which is one part of the treatment continuum. Even within self-help, there are other methods of self-help. There are men for sobriety, women for sobriety. There are a variety of different self-help types of groups. So that's one modality. And then there's professional counseling, individual counseling, and group counseling. So David, the answer is there's a whole range of continuum. you're in Toronto, the program that was mentioned earlier, MARS, M-A-A-R-S, will be a phone book. It'll be online for you. If you've got a question about what options are available for you, that's the place for you to start, given the background you've just given us, and then we'll spend much more time with you.
Mm-hmm. One of the things that I say when I get that question is it's a good question. Not everybody takes to AA. They get really turned off by the higher power piece or something. What I try to say is that the thing that is so wonderful about AA is that it's like a one-stop shopping. It gives you all of the things that are actually out there. You can find them if you're willing to do the shopping around, but it gives it to you all in one. You know, it gives you the therapeutic going back into the past and, you know, unearthing resentments and resolving resentment. It gives you the ability to relate with people, forgive people. It gives you the ability to learn how to ground yourself, you know, in step 11. So it gives you a lot of the pieces, but if the program turns you off, you can get the very same stuff, it's just called something else. You can get step 4 and 5 in cognitive therapy. You can get step 11 in meditation. You can take those things, so you don't have to. What I usually urge people to do is, if they're not going to follow a 12-step program, find a program that is as rigid and as disciplinary and rigid in terms of every day there's a discipline that's involved. I mean, you could become, you know, get involved with yoga, but as long as you do it on a day-to-day basis, because you need to have something to counteract that addictive impulse to relapse and regress. But it doesn't have to be AA, absolutely not.
And there's no panaceas in our field. There's no one cure in the addiction field. And the notion about having structure, I mean, many people who have substance use issues, I mean, that becomes a central organizing principle of your life. As you say, you need to replace something that spent all the time drinking and drugging. You need an alternative. And AA is one alternative, but there certainly are others. Service work, yoga, I mean, there's a whole range of activities. And as we said, the MARS is a great program in terms of finding the balance between self-help and professional help.
What about the cross addictions?
Well, you know, that one, that's such a big question that I'm just going to give a really short, sweet answer. And that is that one of the things that addiction medicine has really turned around in the last couple of years is their definition of addiction, which is saying we need to look at addiction as a phenomenon that occurs in the brain and that has, you know, it focused specifically on neurochemistry that drugs turn on. And I can guarantee you that gambling and cocaine and even sugar turn on the same neurochemicals. So even though alcohol may not be your issue, because that's not where you've stumbled, the fact that you're now have an addiction happening means that any of those substances can turn that process on. I mean, I have never gambled, but I wouldn't go near a poker table because I don't need to find out that I'm addicted to it. So I don't go to Gamblers Anonymous. I don't need to, but I also know that I don't want to do it. So just appreciate that we're not focusing anymore on the substances. We're focusing on what's happening in here. And if that's been turned on, any of these things will re-spark it.
And the other thing with cross dependencies is the question is there an underlying issue? So if you have dealt with one of your drug use and go to some behavioral issue, the question is something else underlying it that has been touched upon too? So that may also be a reason that you have different issues. Is there's an underlying problem that needs to be resolved as well?
David, thanks for your call. We appreciate it. I hope that was helpful to you. Got to skip along now to Dave from Midland on line 4. How are you tonight, Dave?
I'm good. How are you?
Very good.
Yeah, I was listening, and I do agree that, like, for myself, gambling wasn't a problem. But when I got sober, and I was sober for 5 years, gambling became a problem, and I had to deal with that as well. But as far as the support, you know, I've been at this a long time. I was 18 years old the first time I reached out for help, and I'm 61 today, and I'll be 14 years sober in August. And I've dealt with clinicians, and I've dealt with AA, and I've dealt with clinicians that have had addictions problems. And I think that the basic thing that I'm looking for is that they care. You know, first I had to care, and then I had to find somebody else that cared. I deal with my counselor that I had 13 years ago. I stay very close with her, and she's never had an addiction problem. But her approach is to tell me what's successful for other people. You know, this is what's been successful for other people, and if you try it, it may be successful for you.
Great, great, good point, Dave. Do I understand you correctly that today's your 61st birthday?
No.
I was just going to say, if your birthday's same as Teresa, she'll freak. That
No.
She would have loved that.
I'm just saying, I was just trying to make the point of how long I've been struggling with the addictions. I mean, I was in 3 treatment centers, and over 33 years or something like that. I finally got sober, and stayed sober up till now. When I was 46. I'll have 14 years sobriety on August the 14th, which was actually will be my wedding anniversary, on my 4-year wedding anniversary, and my wife's coming up on 6 years clean and sober, July 7th. You know, and we work hard at our recovery, and we don't have to work at it all the time. We have to have some time to play.
Yeah, indeed. Well, congratulations to you both, Dave. Good to hear from you. Thanks for calling.
He really emphasized the needing the professional to care, you know, and I would add to that also that they respect you. Even if you're at your lowest of your low, if you feel respected, I think that it just brings back that desire to reach out.
Yeah, indeed. Okay, we're going to go to another break, and we'll be back in just a minute or so please stay with us.
Statistics state that it is likely you know a victim of abuse. It could be a friend, a relative, a colleague. It could even be you. 1 in 3 girls and 1 in 5 boys will be sexually abused before they reach the age of 18. Please give them hope. Help us make it stop. Go to abusehurts.com and give to the Canadian Centre for Abuse Awareness.
And welcome back, Living Clean, Living Well. And we're here with Dr. Rick Zernick and Dr. Vera Tarman. And we're going to go right back to calls. David from Ottawa on line 3. Hi, David.
Hi. There's 3 Davids in a row.
Yeah.
I noticed that.
I'm calling from just west of Ottawa. I live in Arnprior, and I have 25 years of drug and alcohol free.
Great.
And I suffer from addiction, obviously. I had first realized this when I stayed clean and sober for a kickboxing career I was participating in. So through trying to be a better athlete and be in top physical shape to compete in kickboxing, I stayed clean and sober for 5 years. And then I went on vacation and decided to have a drink at, and it was in Dominican Republic. So 8 double 151 rum and cokes in a row got me right back to where I was. So after when I had, at 31, I decided to go for an assessment at the Royal Ottawa. And through that, they had a list of like 10 questions, like the cards you can get at AA or NA. There's a list of 10 questions, and I told my dad that I had 9 out of 10, and they said, "Well, 3 out of 10, you're an addict." So I figured I got a pretty good score, and he said, no, you used to have the shakes too, so you got 10 out of 10. So I went through drug and alcohol treatment and stayed at the Royal Ottawa. I went on a day program, and I went to this place called Meadow Creek for a month, I guess, 28-day program, and learned all about addiction and as much as they can teach you in 28 days. And then I stayed clean and sober for 15 years by doing it by my willpower, which is what I figured was my higher power. And I joined a motorcycle club, which was the Liberty Bikers, and it's pretty hard to find 10 guys that ride Harleys and don't smoke drugs or drink alcohol. And they were in Val-de-Mont, and I rode with them for about 5 years, and then I became a founding member of the Red Line Motorcycle Club in Ottawa, and I rode with them for 5 years, and then I graduated to become one of the first members to be from Red Line into the Hells Angel Motorcycle Club, and I rode with them for 5 years. So I gave another member my word that if I ever got my patch when I first joined, that I'd have a drink with him, because he used to always ask me why I didn't drink, and I told him I was an addict and stuff. So, and then he'd ask me every once in a while, "Oh, you want to have a drink?" And I'd say, "Do I get my patch?" And they'd say, "No." And I'd say, "Okay, well, I can't have a drink." So when I finally had a drink with him, or when I finally got my full patch Hells Angels, I had a drink with him, and I had such a rush of heat, and like I smoked a doobie, and I had a couple of drinks, and then I got this wicked rush of heat, and I went outside, and I feel that was when the Lord first started to touch me, because about 3 years later, I figured out what my higher power was when I read the Bible, because it says in Romans 13, "Let every soul be subject unto the higher power, for there is no power but of God. The powers that be are ordained of God." So I started to read the Bible, and I read 1,888 pages in 2 or 3 weeks after never reading a book in my entire life, because I suffered from severe dyslexia and never learned to read. I got like my grade 9 education, because that's where remedial English stopped. And I just, was seeing, because of some injuries, I broke my back, and I broke my shoulder, and I broke a number of bones through kickboxing and stuff to prove how tough I was, or, and...
David, it sounds like in being tough, the battle with the addictions has been the toughest one of all.
I don't know. It's my own ego was the toughest one of all, I think. And I was seeing a psychiatrist because I went on disability through my work, because I become catastrophically disabled in a motorcycle accident. And the doctor was an MD, an LMCC, a CSPQ, FRCP, and a VPT, Associate Professor of Facility of Medicine, University of Ottawa, Geriatric Psychiatry and Adult General Psychiatry. And when I told him that I started reading the Bible, after about a half an hour, I was looking at my watch saying, I think my time's up, because every time before that it was the opposite. And he got so excited that I was reading the word and wearing a cross. He was telling me, oh, you know what that represents? And I said, what? And he goes, it represents salvation.
David, do you have a question for us?
Pardon me?
Do you have a question for us that we can
No,
answer?
I just called to give my testimony, and
Okay.
hopefully that will help some of your listeners, because I believe that's what the 12-step program's supposed to show us, what we're supposed to do.
David, thank you for your call, and we appreciate that. And it brings up the issue of spirituality and the role that it plays.
Yeah, the piece that I really heard from what David was talking about was he said that for a long time he used his own higher power. He said his self was his own higher power, and it didn't seem to work all that well eventually, because he still picked up that drink. But when he found another higher power, it sounds like it wasn't a 12-step program. I'm not sure what he was going with there, but it sounds like he found another higher power that did help.
Yeah,
And I think that's really the key.
indeed.
Yeah.
We've got time for one more call. We've got Wayne also calling from Ottawa on line 5.
Hello?
Hello, Wayne.
Hi. I guess my question is, do you see the direct connection between chronic pain and, actively pushing forward your addiction in a biological sense with the brain?
I didn't get the question. Sorry, can you ask that question again?
Yeah. Do you see a direct connection between chronic pain and emotional pain pushing forward addiction, causing your addictions to be active?
Oh, absolutely. Chronic pain is a major stressor. It's chronic pain, even acute pain, just initial pain is painful, is a stressor. But a person who's living in chronic pain, we know that it makes a person more depressed, more anxious. You never know when the pain is going to let up. It's a major reason for a mood disorder and then a self-medication addiction.
Well,
add to that.
Of course, and the initial response from most physicians who want to support you is by giving you a psychoactive drug.
Yeah.
So, that's a natural response to it, and that supports the development of a substance use over time. It's a very negative cycle.
Yeah, it's a negative cycle. So yes, it can cause depression. Then you take medication, which then fosters more addiction. But the good news is that with chronic pain, there are techniques that you can use that are not necessarily medication-based and that do help with mood. So yes, you're dealing with a stimulant for addiction, a stimulant, whatever. But there's a way out of it. There's hope. Yeah.
Can you talk a little bit more about the way out?
Well, there's techniques that, you're absolutely right. What we do is medicate, but do you want to add about
there's a variety of ways. The reality is the first point in time is chronic pain is going to be there, so acceptance of the fact that that this is part of your existence, and what can I do to mediate it? Not medicate it, but mediate it. And so we've got some very basic things. Meditation, breathing techniques, yoga, any sort of physical activity. The first thing you do is you take the drug, you relax. Well, this further shuts down your body depending where the pain is. I have some wonderful students who have a variety of congenital issues, and they are active in spite the fact that they are wheelchair bound. You can still be physically active. The notion of wellness, right? You can have physical limits, but still be well. You can still deal with your psychological health. You can deal with your spiritual health. You can deal with your intellectual health. There's other elements that you can act upon and work upon besides the physical pain. The more you withdraw, and the more the focus of the pain becomes the center of your life, the easier it becomes to have drug become the response. So it's looking at those alternative life options. And what else can I do other than live in the pain?
Yeah, and one of the things that people aren't told when they seek out medical care and get medications is there's two things that it's useful to know. The more you take it like an opiate medication, the more hypersensitive you become to pain. So actually your pain potentially could get worse in the long term. And then the other thing is that even with medication, like an opiate use, OxyContin or something like that, you can never expect full recovery. You're still going to have to learn to live with the pain. It might mitigate or lower the pain, but it's not. But really, success from a medical perspective is 60% control of pain, not 100%. And people are led to believe that it should take care of the pain completely, and that's not the case. So if you're going to learn to live with 60%, there are really techniques, like you mentioned, meditation, even cognitive therapy, which helps you to have a different perspective on that pain so that you can live with it in a different way. Yeah.
Okay. Well, when I look at sort of where we've come in our conversation through tonight, I'd just like to, get us to a point where we've got a couple of minutes left where maybe we can sum up some of the things that are really key to our viewers and to anyone who's going to be seeking help, and we encourage people to seek help. There's sort of a checklist of things that we've talked about in terms of making sure that you've got somebody that knows what they're doing, that they are accountable in some way, somebody that's a good listener, somebody that is compassionate, and perhaps, if you get a sense that somebody cares about you and what's going on and it wants to help you get better, and also that they, it's you that has to get better. They don't have the problem you do. Their job isn't to eliminate all the pain. Their job is not to apply the magic cure, but rather to get to a point where they can help you get to where you need to go.
Yeah. If I could add another piece, I would like to tell the audience too that gone are the days where you could go and ask for medical counseling, like I'm going to see a psychiatrist and talk about my issues. Those days don't exist anymore. If you see a psychiatrist, they don't have time to do therapy anymore. They're really looking at how can they medically, pharmaceutically manage your problems. So if you're looking for therapy, there are avenues out there like CAMH, like we mentioned, going to Mars. But you may also have to decide to figure out if you can pay for therapy, because that's really where the therapy is, if it's not within the institutions.
Yes, indeed. Yeah. Okay, we're going to go to our final break, and when we come back, we'll say our good nights. We'll see you in just a minute.
I've had numerous opportunities to get into addiction counseling over the past 5 or 6 years. This one at New Awakenings really appealed to me. First off, the facility here. We've got a swimming pool, there's a gym downstairs. Other side of the fence, golf course. It's fantastic, and the food is, world class. The staff cover all aspects of recovery. These are people with extensive experience in the field, all with the sincere desire to be helpful. If you want a shot at recovery from drug and alcohol addiction, New Awakenings is your best bet. Give us a call. We'll get right back to you.
And welcome back. It's Living Clean, Living Well, and we're done for another session. I want to thank Dr. Rick Zernick and Dr. Vera Tarman. And Rick, concluding words.
Just to send you home by, as we've heard from the people who've called in today, counseling works. It often people who are not successful go to assessment but don't follow through. People who follow through and continue with counseling, even though the road is often very bumpy, succeed. So stick with it.
It works if you work it.
It works if you work it.
Okay, well, we want to thank you for tuning in tonight. Want to say thanks to our crew, to Jeff and Joanne in the control room. Our phone-in producer tonight has been Denise Spector, helped out by Russell Rettensing. And so we want to thank everybody that participated in putting the show together. And next week is a long weekend in Ontario, so we'll have a repeat show on. We'll be picking something good for you. And so we'll say good night for now, and hope that you all take good care of yourselves and be well. Have a good night, Kirst. We'll see you all soon.
Living Clean, Living Well has been a presentation of the Canadian Centre for Abuse Awareness.